Hi guys, we'll be reviewing Basecamp and its potential impact on varying healthcare businesses. Firstly though, we need to look into what the application is, who they are, where they've come from, and what they look to do going into the future. So with that in mind, let's dive right in. Basecamp was founded in 1999, being formerly known as 37 Signals, by Jason Friend, Carlos Segura, and Ernest Kim as a web design company. In 2003, Basecamp was created, and in 2005, the organisation stepped away from its consultancy work and pushed primarily into web application development, with Jeff Bezos taking a minority stake in the company. Over time, it has progressively grown on its web applications foundation and added a platform for team communication after users highlighted the need for a way to communicate effectively with and between company teams. With a firm focus on the simplification of project management and an easy communication software, it aims to make the day-to-day operations of business simpler and more efficient. Basecamp as a software is used in over 150 countries worldwide with north of 50 million users. Basecamp has slowly evolved and added features and varying iterations to keep the application up to date and current to its current clients' needs and wants. This is done by the progressive addition of features such as to-do lists, milestone management, forum-based messaging, file sharing, and time tracking. Paired with these project management tools, Campfire was released in 2006 to implement an intercompany communications platform. The ability to create and add custom teams and departments, whilst granting access, when applicable, to clients creates an environment that both saves time, increases accountability, whilst also increasing efficiency. Continuing to grow with over 50 million projects having been managed through Basecamp over the duration of its existence, the program has been refined and tweaked to ensure that the client's expectations are needs and continually met. Healthcare is being driven by an electronic change and a push for telehealth and e-medicine, so it seems crazy not to have a project management and communication tool to suit. Wheaton Francis Healthcare, based in Milwaukee, stated that Basecamp assists by better departmental awareness of the number of types of projects on our plates at any one given time. All project status details are available for review by our team at a glance, with everyone knowing just what someone is up to. Wheaton Francis Healthcare spans across multiple hospitals and healthcare facilities and have seen a dramatic change in individual and team accountability, as well as individual and team productivity. If Wheaton Francis have seen these dramatic shifts after the application has been implemented for the software and its growth, it could reliably be used across other facets of healthcare as well, such as individual private practice as well as larger healthcare facilities. I'll now transfer to Daniel to talk in more detail about how the specific aspects of the platform best assist healthcare businesses.
Basecamp can be beneficial as a platform for health organizations as they provide the tools that individuals and teams need to manage projects and collaborate. This cloud-based application may enable health organizations to get a better handle on team projects, have fewer meetings, and provide individuals or groups with the opportunity to be given specific tasks or projects with a due date.
Because people aren't able to get work done at work anymore. What's happened is our days are sort of eaten up by meetings. There's tons of distractions at the office, and the modern workplace has more distractions than it's ever had in the past. And so we started to look at our office and the way we worked and try to figure out what are the things we could eliminate, what distractions could we eliminate to give people back their time and attention so they had 40 hours of their own time rather than 15 hours of their own time and 25 hours of company time. conversation is then gone after that. So we instead write things down and then share things across the company on people's own schedules and own time. And this is a fundamentally different way of working, but it reclaims hours and hours a week. How many hours are people spending in meetings? Oftentimes it's a few hours a day. Sometimes it's many hours a week. And if you really start to add this up, you start to see how much time you can get back. You can still share the same amount of information, but you can each person can absorb it on their own schedule versus on the company's schedule when you do everything together at one time.
As explained by John Fried, CEO and creator of Basecamp, this would be beneficial for a health organization as it can cut down time spent in meetings, allowing each team or individual to work in their own time as efficiently as possible. Furthermore, Basecamp can be used as a more effective way of working, as a health organization can collaborate online and spend more time working with less distractions to improve work ethic and improve organizational progress towards health goals. The base of operations is the homepage for Basecamp. This allows users access to all different features such as Campfire, message board, to-do list, schedule, check-ins, and the docs and file sharing system. To-do lists can be very beneficial for an organization because it allows each team or individual to be assigned goals or responsibilities for each day, week, or month, with an associated due date. These also are available for viewing on the projects calendar. Furthermore, each health-related project or goal for a team gets its own Basecamp project. Now, this project can only be accessed by the team allocated. This team can now discuss, chat, and share ideas and findings via this work area. The Work Can Wait feature allows each team to customize their notification settings. This minimizes cluster and allows each team to only receive important information that is related to their project. The most beneficial aspect of Basecamp is the effective communication methods that the application allows. Basecamp is focused around collaborating with others, creating new ideas and tasks in relation to working towards a project or goal. Campfire is a feature that allows real-time group chat, allowing members of an organization to discuss reports, findings, and other health-related ideas. The project schedule can be beneficial for a health organization as it's where all the important dates and events are posted, such as meetings, important due dates, or day-to-day tasks. Each task can easily be accessed by every user and allows each user to comment or chat about the event or task. The progress report allows users to find information regarding progress on individual and team projects from current to previous projects. This allows organizations to keep users updated on changes and allows reports to be made in relation to project progression. The docs and files sharing system is an important feature of Basecamp. It allows project teams to upload files, share materials, and develop documents. Each team has its own document sharing area relevant to each task they are aiming to complete. This will be beneficial for an organization as they can break employees into teams to work towards different health goals and share relevant files. This allows users to browse through every discussion, file, to-do list, and email that's been shared and communicated between users. This is beneficial as it allows users to easily find relevant findings, discussions, or shared documents that can be useful in helping them towards their health goal. Basecamp is only $99 per month in total, which allows unlimited users, projects, and access to every feature on Basecamp. This includes 500 gigabytes of file storage. This is beneficial for health organizations who are wanting an application for sharing ideas and communicating efficiently on projects, rather than using apps such as Slack or Asana. These other apps charge per user per month, which can be very expensive for larger organizations in the long term.